Okay, now I am in my shorts, getting ready to start my infusion. Everything, they're still clamped off, and I have 3 sets clamped off. A tip that I have is when you are getting ready to put it in your leg or your arms, your abdomen, your back, wherever you're going to put it, when you pull the little plastic needle cover off, I recommend wiping that down with an alcohol wipe, because for me, if you don't wipe it down, when you stick the needle in, it kind of burns. So here we go. I know generally where I'm going to put it, and you just have to make sure you put each one about 1 inch apart. So once I put my first one, which first I wipe the skin off, then I take one of the needle sets, pull the plastic piece off, then you see the needle. I take that same alcohol wipe inside of it, wipe it off, then make sure you're not sticking it in a vein, and I pull the skin, stick it straight in, release the flaps. Then I take my rounded Primapore dressing, the needle's in, it's not moving, peel the adhesive off, tape it down. I don't remove the clamps yet. So I proceed on to the second one. Do the same thing. Oops, one thing I forgot is to wipe the skin off. Then sometimes I can't concentrate, especially if I'm trying to do 2 things at once. Let that dry. And I usually take 2 fingers. The needle is in the middle. The flap is on the side. So I know I can put my needle right there because it's at least 1 inch away. So second needle's in. Peel the adhesive, the backing off of the Primapore is what I use. Most people will be using Tegaderm. Take the third one, and I usually do I do 2 side by side, one kind of like in the middle below. That's where I'm going today. Now I will take my third needle set, pull that protective piece off, wipe the needle off. It is dry. I make sure that those lines are out of the way. And I kind of see a vein right there, so I'm not going to go there, but I can go above it and be fine. Pull the backing off. Now, I take my pump, the syringe, have them parallel to each other. See, it goes like that. Like that, you make sure that they're lined up. Slide it in. And on here, this is your on and off area. You flip it that way to turn it on. And this is your, when you're done, you actually first you turn this on. It is now going on, and you see the little thing moving. Clicks into place. When it's done, you turn it off and you wind it backwards, or you wind it actually counterclockwise. So now what is left, I just put that down and I unclamp my needle sites. So now my infusion is actually running. I put the time right here where his time infusion started, and my infusion is now starting at 7:15 p.m. So I write that down. And this usually takes about an hour, hour and 5 minutes for me. When I am done, what I do is I usually take some gauze, cut it into 3 strips. I use 3 strips of paper tape because sometimes my sites bleed. So I cover them up for about an hour with paper tape because I'm allergic to regular tape. And that's about it as to far as what I do. And any reactions, I would write them down. Normally makes me nauseated, sometimes a mild headache, sometimes I feel a little lightheaded, and I can tell if my blood sugar is getting low. I will check my blood sugar and then take the proper steps to correct that. Once everything is done, also something that I have found is I already have a sharps container, so I will disconnect this. Once I disconnect each one, I do not put the full thing in the sharps container. I actually cut it about there and just dispose of the 3 needles along with that backing in the sharps container. And then I am done till next week.